Hello and welcome to this course. Today we are going to learn the growth potential of the bionanotechnology, challenges and its opportunities in this particular field. So now let's understand what is growth potential in the bionanotechnology. So here based on the data published by the Consulate General of India, It so the here this global nanotechnology market size has increased from here $16 billion to almost close to the $76 billion here from 2010 to 2020. So in 10 years, so that market size has increased from $16 billion to 76. And so this market size is approximately increased close to this fivefold in the 10 years with the CAGR. So here CAGR means compound compounding annual annual growth rate. So that market is increased with the close to the 17 CAGR. So it has a huge potential and increase in this 10 years. And based on the others agencies, for example, so according to BCC report, the nanotechnology market is expected to increase from, sorry, market is expected to increase according to the BCC from 2021. So that was market approximately $38.5 billion, and that is expected to increase from now to in 26 is close to $68.4 billion. So, so this growth is expected to increase with CAGR, and that is approximately almost 12.2%. So here, this market is of the bionanotechnology, and based on the others report published by this global, so according to the others agency report, and that is the global industry industry anal- analyst analyst. So they expected that this market will increase in, so that was market in 2020 was approximately $62.3 billion, and that is expected to increase by 2027 is close to $100 billion. So there's a huge increase in this bionanotechnology. So once we have seen that okay, there's a huge market market of this bionanotechnology and nanotechnology in the coming years, then we need to understand what are this market segment. Because if you know that market segment, then we can focus at that market segment as an engineer, as an entrepreneur. Maybe you are, if you are as a business person, then you can also look in that perspective on that particular lens. So here the nanobiotech technology has the different segment. For example, it has the application based segment. So if you know what are the application of the bionanotechnology, so it has many different application. From the drug delivery, we have the diagnostics, we have the therapeutics, we have the preventive cares, we have the cosmetics and the pharmaceuticals. So it has the diverse application based market segment. So out of these different application based market segment, so here the drug delivery drug delivery really has close to 55% of the market segment in 2020. So only the one application, drug delivery, has potential, and that has the 55% market share in bionanotechnology. So, so if you're looking the business in that particular uh, areas, then you can choose this drug delivery, maybe. And based on the technology-based market, we have the different kind of technology that is based on this nanomaterials, that is based on the bio-nanomaterials. We have this quantum dotted materials. We have the nanopores. We have polymer dendrimers and the liposomes and the nanocrystals. So these are the different kinds of this material-based or technology-based market. So based on all these kind of the materials, here's polymers based materials. So here's polymers and polymers, dendrimers, dendrimers, and the liposomes has the market share that is close to 50% in 2020. So here, if you think about why does the polymer kind of the materials has more market share as compared to the other nanomaterials, quantum dot? Because whenever we think about the nanomaterials for this biological application, polymers, dendrimers kind of material has this more room for the different kind of functionality. So that can be used easily in this drug delivery applications. And that's why it has a direct contribution from this area of research, that is the drug delivery. And that's why the polymers, dendrimers has 50% market share. And the third parameter is based on the geography based. So so here the first bigger market of this technology is the North America. And the countries in the North America are US, Canada, and Mexico. A second is the Europe, and then the Asia Pacific, Africa, Middle East, and the South America. So here there is a huge market in the North America, followed by the Europe and Asia. Even though if you are looking for this Asia Pacific application, then yeah, there's a huge market in India and China. And if you're looking for this market segment based on this disease-based based segment, then they are the application of the, for example, we have this cardiovascular based areas, neurological disorder kind of the diseases are there, and we have those cancers. Okay, so we have this cancer kind of those of these areas, or maybe the infectious functions diseases, for example, as virus, bacteria kind of the uh, infectious diseases and other diseases. So here we can focus on this either the cardiovascular diseases, neurological diseases, and the cancer. So these are the most three different important disease-based market segment. So you can look for the three cardiovascular, neurological, and this cancers based market segment and develop the product for these diseases. And I talked about the technology based market segment. So as I explained you, in technology based we have the different kind of the materials. We have the dendrimers. Sorry, we have the dendrimers, we have the liposomes, we have the quantum dot, micelles, nanospheres, nanoparticles, polymeric nanoparticles, and carbons kind of the materials. So we have the different technology. And among different technologies, these has the major contributions in the nanotechnology, and that is close to 55% market share. So we can use this one in this drug delivery. A majority of this kind of the materials used in the drug delivery and the cancer therapy kind of the applications. Okay, so now we understand what is the growth potential, what is the market size based on this technology, based on the disease, based on the countries, based on the applications. Now let's understand what are the opportunities, challenges in bionanotechnology. So here the challenges in the we need to understand that what are the key challenges in the bionanotechnology so that we will find the opportunities. Here, the first and most challenges here is the long-term healthcare. So here the big challenge is that we need to develop the affordable and sustainable kind of the health devices or maybe the medicines so that can be useful for the long-term monitoring of the patient. So here we need to develop the devices or the product that should be affordable for and the long-term monitoring of the patient. Second challenge is in the aging problem. So we need to develop the product so that can increase the life expectancy of human beings. So we can improve the if the health of the senior citizens so that we can increase the overall the life expectancy from 60 years to the maybe 80 years. And the third problem or challenge is that the social interaction and the support. So in the digital age, if we are looking for this product development so that can monitor the patient remotely. So in that case, there is a problem. And that problem is the lack of the social interaction. And if there is a social interaction, we cannot support the patient in that particular way. So in that case, we need to find out the solutions, possible solutions, so that we will have the interaction and the support both, both at the same time. And the fourth major challenge is the resource constraints. So as we know, if we have a small demand of any product in that case, in that and we have the limited resources, in that case we need to work in that particular area so that we will have the proper supply of the our product. So these are the challenges, and these are the four key challenges. So now, if we understand the key challenges, so based on that key challenges, we need to find out what is the new trend of the technology. So first important new trend is about the self-care and the management. Here, the self-care means that we need to develop the medical devices or maybe the healthcare monitoring devices so that can be used as a self-care. For example, if we develop the maybe the health band, if we develop some kind of the chips, maybe the kind of kind of this biomedical machine so that can monitor the health of the patient. For example, if you just use the chips kind of the material or maybe the fit band, so that can monitor our the glucose level. We can that can monitor our heart rate, and that will give you the real time monitoring of this patient, and that will be going and that will help the patient in that particular way, and so that we can treat that patient on timely manner. So this is all about the healthcare product. That is self-care. You you are going to develop products so that patient can monitor their health by themselves, and that is the huge market. And the second kind of the new trend is about the person-centric healthcare. Yes, because of the development of the nanotechnology, we can develop the and provide the health care to the patient based on the specific need of that patient. And that is the person centric. For example, if any suppose some person has the, for example, the cancer, and the medicine available in the market is this, that medicine is the for the all these people, for the mass level of the medicines. But if we have any particular case study, in that case, if we have the person with, and we need to find out the exact and what is the best medicine for them. So in that case, we if we have the nanotechnology based of devices so that we can test the efficacy of that medicine on that patient and find out the out of maybe 10 or 20 medicines for the cancer, we find out the best medicine for that particular patient. And that is the way of the doing of the treating the patient. That is the person centric healthcare. So for that, there are the many researches going on the lab on chips and the lab on organ. So you have the microfluidic device in where you just place this the organ the and test the efficacy of that drug in that particular patient. And if that works best out of the 10 or 20 drugs, so you can use that particular drug to that patient. So that is going to increase the overall the efficacy of the drugs. At the same time, that will decrease the side effect. So this is all about the person-centric healthcare. And the third point is about the affordable excellence. We need to develop the materials for, and that should be the cost effective. At the same time, that should be the ecological sustainable kind of things. And these are the three new trend is coming up in the future. Now it's present. So research is going on this self-care and person-centric healthcare. Now we need to also focus on the affordable excellence of the material of this product. And based on these challenges and the emerging trend, we have the many opportunities in this area. So, as an engineer, as a scientist, as a healthcare provider, or maybe you are the stakeholder of this field, you can get benefit from these opportunities. And these opportunities, for example, first one is the health communication. So we need to understand what is the health communication. What is the health communication and how it is going to be helpful in this field. For example, if you just compare time maybe 5 to 10 years earlier, in that case, if you want to check up your body, then you should go to the doctor and give you a sample, and in that case, and then after the doctors analyze your data and give you the and prescribe you some medicines. So this is about, so this is time consuming process. At the same time, in the emergency conditions, you will not going to give the exact medicine to that particular patient and we lost life. But in the future, it is expected that we need to develop the product that can monitor the patient life in real time. So here, in the future, we are going to look for the real time monitoring. Monitoring of the patient using the device, portable device. And the second is that if you are monitored the real time in that case, so that data should transfer to the healthcare provider, right? So here we need to develop the technology so that IoT, so that can transfer data to health care provider, right? So first we need to monitor the health of a patient in the real time and transfer the data to the healthcare provider or doctor, and based on the data analysis, doctors will prescribe the medicine online. So you don't need to go to doctor, and doctor can remotely prescribe the medicine to the patient. And in that way, we can save the many lives in the emergency, or even we can save the cost of the traveling and the time, all these things. So these are going to change in the near future. So you can contribute in this particular health communication as a engineer. And the second opportunity is about this prototyping. So before developing the final products, we need to develop the earlier design of that product, maybe that medicine, or maybe the sensor, maybe the device. And that device has the capabilities to have. And based on that prototyping, we can increase the efficiency of that product after the many testing. And the third is the core design. So core design is very important. Nowadays, if you are looking to if you are looking for any kind of the design, in that case, we need to collaborate with the different stakeholders. So here in the biotechnology or healthcare sector, we need to design and collaborate with the scientist. We need to collaborate the scientist. We need to collaborate the engineer. We are also going to collaborate. We need to collaborate with the doctors and patient. So here, if we collaborate with all different stakeholders, in that case, we will have the more efficient product, and at the same time, that product should be the uh, patient and that should be the comfortable to the patient. So these are the product design, and you will get the defined version of the product, and that it is more efficient, and that will lead to the large patient worldwide. So these are the opportunity in this co-design part, and others is this frugal innovation. So now let's understand what is the frugal innovation in that technology development. So frugal innovation comes if we have the three major problem constraints, and that constraints is about this market affordability constraints. Suppose if any product is available, so if medicine or the product is available in the market, but that is very costly. So in that case, so patient cannot afford that medicine. So that is the constraint. So you can take that as this opportunity to develop your product that will be the cost effective, so that can reach to the larger audience. And if we have the resource scarcity or the constraint, in that case, we need to look for the alternative materials for this that product development. And if we have this institutional virus or this complexity, if you have this too much complex, in that case, frugal innovation comes, and that frugal innovations will give you the product, and that product will be simple. Okay, so frugal innovation will give you the simple product that will give you the cost effective product. So here this frugal innovation means you are designing this product without, and that at a low cost, without maybe without compromising the quality of that product. So here the frugal innovation means you are going to develop this products with, and that is the cost effective at the same time. That product should be cost effective at the same time without compromising quality quality of product. So this is the frugal innovation in which you can develop materials or the product that is cost effective at the same time without the compromising on this quality. So how we will develop such kind of the materials? So in this such kind of the materials, here we can take the example. Here's the code designs, prototyping, and the health communication. Is that we can, if you here's in health communication, if we have the technology for the real time monitoring, so in that case, you are saving money of the patient, you are saving time of the patient. In that case, you can give the affordable screening of a patient with the low cost, because the patients can get this proper treatment remotely using the your technology. So here you have the same qualities is there, but you are reducing the overall the cost of this treatment. The second is about this prototyping. So in prototyping, you can use the cost-effective materials for the your designing purpose and testing purpose. If you get the proof of the concept, in that you can develop the further that materials. So this is all about this how you can decrease the development cost of that product without compromising the quality. Now let's understand what are the challenges in the bionanotechnology, and that is the challenge in terms of the health risk. Let's first understand what are the possible health risks by handling nanomaterials. First, first challenge and problem comes from the toxicokinetics. Here, toxicokinetics means that here we as handling nanomaterials, and that has size from 1 to 100 nanometer range. So, so if the material has a very small size, so in that case, so that material can pass through the many barriers present in our body. So in our body, we have the different barriers, different barriers in our body, and that barriers are the physical, chemical, and the physiological. So these are the different barriers present in our body, and these nanomaterials has capability to pass through the all different kinds of the barriers. And because if that pass through the different kinds of barriers, that damage, that interfere the properties or the functioning of that organ, and that causes huge health risk. So this is about the toxicokinetics because of this the diffusion of these materials into the different barriers, so that it can causes the potential health risk. And the second kind of those health risk is the biopersistence. For example, if patient has such kind of problem, maybe the liver, kidney, or and some problem with some kind of organ, and doctors give you the nanomaterial based medicine. But the problem is that with the nanomaterials, nanomaterials, if that nanomaterials resides in that organ for the long period of time without without uh, living with this proper time. So what happens here is that if that nanomaterials resides in particular organ, so that process and that is called the biopersistence of that nanomaterials. And because of that nature, that will harm or damage that particular organ. For example, if liver has too much of this nanomaterials accumulation in that organ, and we know the nanomaterials has higher reactivity as compared to the other material because of the large we have the surface areas to volume ratio. So because of the high surface area to the volume ratio of nanomaterials, it is highly reactive. And if the nanomaterials is accumulated in particular organ, in that case, it will damage that particular organ. And these are the possible health risk comes from the nanomaterials kind of this medicine or the technology. And if you want to know about those in more details about the what are the key more challenges in nanotechnology, because if each kind of the technology has their dark side, and the dark side of the bionanotechnology is the health risk. So here that materials causes the health risk here. So we need to understand about what is the safety issue that materials. We need to also understand what is the environmental issue of these materials. What is the risk assessment? We need to know if we develop such kind of the nanomaterials, we need to understand what are the possible risk of that nanomaterials or nanomaterial based devices. We need to know what is the social responsibility. We need to know what is the regulatory guidelines. And as we know, because of the harmful nature of the nanomaterials, we need to proper dispose the nano waste. And other important point is about the ethical consideration. See here, the ethical consideration comes here. If you want to develop the work on the health communication and you develop the such kind of devices which can transmit the data remotely from patient to the healthcare provider, so in that case there is the misuse of the patient's data. So in that case, the ethical consideration comes how you handle your data, how of the patient. So these are the very important consideration in this in the nanotechnology. So we need to so whenever we are working with the nanotechnology or the nanomaterials, we need to be careful about the handling of these nanomaterials because of its the toxicity. And after the use of the nanomaterials, we need to properly dispose this kind of the nano waste. So this is all about the growth potential, challenges, and the opportunities in the bionanotechnology. In next class, we are going to learn this nanomaterial synthesis. So we are going to learn the top-down approach and bottom-up approach of the nanomaterial synthesis, and we are going to use different techniques, physical methods, chemical methods, and the biological methods to synthesize nanomaterials. Okay, see you in the next class. Thank you. Thank you very much.